Stephen Rosenfeld. I'm one of the physicians here. I've been here for 10 years, and one of the nice things about this facility, I think, is most the physicians and the nurses, it's really a welcome clinic. When people are diagnosed with cancer, they hear the word cancer, it's scary, obviously. I think people's impression of cancer clinics and oncology clinics is kind of depressing and dark and gloomy, but our clinic, I think, is the opposite, and I think that's it's reflected by the staff's attitude towards the patients. The chemo nurses, it's lively up there, and it's friendly and helpful, welcoming, warm. It really puts people at ease. They feel like they can trust us, and we're here for them. We're available for our patients 24 hours a day. We're on call. There's a physician on call 24 hours, after hours, on the weekends. We're present in the hospital, and so we just try to make ourselves as accessible as possible. Our chemo nurses, our pharmacists, our technicians, our medical assistants, their one goal is to take care of the patient, make sure they're okay, help them get what they need to help with their lives. It's not uncommon for somebody to finish their chemotherapy, and a year later I'll see them in the clinic and they'll say, well, I'm going to go up to the chemo area and say hello to the chemo nurses, because they've developed this rapport, they've developed the relationships, and they just want to say hello and see how that nurse's daughter's doing or family member. So they really develop relationships, and it's a tough thing to have to go through for a lot of these patients, but it can be quite rewarding for everybody. Highlands Oncology Group was started by really one physician, Malcolm Hayward, and then when Dr. Bradford came along, and then it's just grown from there, and it became apparent and evident that a lot of our patients were somewhat ill, older, unable to move around, and so as the clinic has evolved and grown with more physicians and nurses, we've been able to offer bigger scope of things we can do here. For example, when a patient has a 4 or 5 hour chemotherapy treatment, they're able to come and be able to get their prescriptions filled for their nausea medication or their diarrhea or their pain. They're also able to meet with a chaplain. They get the chemotherapy teaching from our well-trained nurses. And if we need to do a scan, if we need to do an ultrasound emergently at 4:30 because we feel like there's a DVT or a blood clot, or we feel like somebody's having a quick bleed, we can get a CAT scan. So we have the imaging available here. The patients are familiar with our clinic. They know how to get here. They know the personnel. So we're able to get them in here for pharmacy needs, for imaging techniques, our blood draw, obviously, a chaplain. So we try to keep it so they're able to just come here and get what they need and then go home. Some of our older patients, it's hard for them just to get here for their visit, period, let alone to have to go to a pharmacy to then go get a scan and get other things. So we try to make it easy for the patients and kind of a one-stop shop for them. Again, we've tried to make our clinic as comprehensive as possible with the radiation facility, the medical oncology. We all are busy and take care of a wide array of tumor types, and we all feel comfortable taking care of everything from thyroid cancer to colon cancer to leukemias. And we do have relationships with others at MD Anderson and Barnes and Mayo Clinic, and so they're just a phone call away for some of the unusual or rarer tumors, so we're able to give them what they need, current standard of care, without them having to travel. They're able to be in their bed with their family members, and that's always easier.